Stephan Baldus, Mike Gibson coming to you live from TCT 2024, and we're talking about the MATTERHORN trial, comparing a transcatheter approach to a surgical approach to atrial mitral regurgitation. Stephan, talk to us a little bit about what you did and what you found.
Yes, thank you, Mike, for this invitation. So the MATTERHORN trial, which was published just a couple of weeks ago, randomized patients with functional mitral regurgitation and an operable status to either TEER technique, so transcatheter mitral valve repair versus surgery. And the basic results of this trial overall was that efficacy was very comparable to both treatment arms. However, safety was much more in favor of TEER in this patient cohort, at least over the follow-up we have so far of 1 year. Now, it's interesting that functional mitral regurgitation is basically covering a large and very difficult cohort of patients with different etiologies of this disease. So we have functional ventricular mitral regurgitation as well as functional atrial mitral regurgitation. And we wanted to sort out whether there are differences with respect to safety and efficacy in these specific subgroups. And what we basically found was when we are focusing on leaflet tethering, a paramount feature of patients with ventricular disease having secondary functional mitral regurgitation, that we basically found that in these patients with tethering, efficacy was, as for the entire cohort, comparable. However, safety was immensely better in those patients treated with TEER. In the patients who didn't have tethering, a smaller group of patients, we basically saw that efficacy was the same, but again, safety was much better in those patients receiving TEER technique. And then we went on and looked at atrial functional mitral regurgitation, a small group of patients. We identified 34 patients basically fulfilling all criteria of atrial functional mitral regurgitation. And again, we found basically that the primary efficacy endpoint was mentionable in 21% of the patients in the TEER group, as compared to 29% in the patients randomized to surgery. And safety was 70% versus 82% with respect to the occurrence of this safety endpoint. So across all subgroups, we basically found that in particular, even in patients who were deemed more suitable for surgical therapy, safety was in favor and remained in favor of a TEER technique, and we did not see any disadvantages with respect to efficacy in the subgroups tested.
Stephan, remind me and the audience, what was the safety endpoint again?
The safety endpoint was rehospitalization, death, and re-intervention.
Those are pretty tough safety endpoints, pretty hard endpoints. Well, Stephan, congratulations. Thanks for sharing this with us, and thanks to all of you for joining us here today with this live update from TCT 2024.
Thank you.